Great. Thank you for having me, Shannon, and I want to welcome you guys all to, and I'm going to be talking just a little bit, slightly different. You got a little taste of some lupus information earlier today, and I'm broadening it a little bit. I am a pediatric rheumatologist, but I also have another hat. I'm a physician informaticist, so I deal with technology and electronic health records and that kind of thing for Stanford children. So I'm going to just talk a little bit about some opportunities and just give you a taste of, hopefully you learn maybe a little bit about these types of digital health platforms that hopefully you can utilize and help your health by being able to connect with your physician and healthcare representatives and information in a meaningful manner and in a more efficient manner. And obviously, since we're in more digital realm these days, I think just catching the healthcare system up to that as well. So if you have any questions, this is not actually a very lupus heavy talk at all, but it's sort of technology heavy, and so if you have any questions, please let me know, and I'm happy to take questions at any time. Okay. So I just wanted to talk a little bit about some scenarios to begin with, so you can kind of think about how you could use technology in your healthcare pathway. We have a patient seen at a local medical center who wants access, right, to be able to make appointments easier than having to stay on the phone for 30 minutes waiting for the scheduler to come on and back and forth, and you miss the call and they miss the call and telephone tag happens and that kind of thing. They want to see some of their medical records, and you have a 19-year-old lupus patient who wants access online to be able to give information like their parents or another guardian wants information as well. How do we do that? There's some confidentiality issues, security issues that kind of come up, and I think people are always a little bit leery of, what can I look at online and can anyone else see it and that kind of thing. So that's also, something that people worry about. And another scenario is a patient working full time at home, at work during the day and has a rash but can't get to their doctor. And how do I get that information to the doctor so I can get, again, meaningful, timely care? So these are all sort of scenarios that I'll address and take a look at, and you can kind of think about in your realm and in your world what could be useful for you. Okay, so I wanted to talk a little bit about patient portals because I think this is at least the beginning of touching technology through your healthcare system. So basically, patient portals are web-based connections that allow patients and families to interact with healthcare providers and the healthcare system. And this is a list of all the different activities that are current, and I will talk a little bit about them so you guys can hear, because I don't know if everyone knows about them. I think it's important to know that you have access to this. So messaging, viewing medical records, requesting appointments, paying bills online now is available, contributing data to the medical record, so contributing data to your own healthcare record, video visits, so instant, almost like FaceTiming your providers, and then also there's some inpatient uses too that I'll touch upon too, which I think is actually very exciting. So, there's some issues surrounding, and I kind of touched upon that before, with regards to confidentiality and security, and I don't know if you guys are familiar with HIPAA, H-I-P-A-A, Health Insurance Portability and Accountability Act of 1996, a long an acronym, it was passed by the United States, and it basically helps provide data privacy to patients, right? Basically safeguarding your medical information, so you don't get your medical information, sent all over the world, and other people are looking at it and that kind of thing. So the issues I think that we always look at is access. Who has access and to the data? Security. People are sort of scared that it is not secure. You hear all the time about data breaches and security breaches, and then the confidentiality and privacy, making sure the right people are looking at the right information. So all of those things, I think, the HIPAA security rule tries to oversee and have oversight and really have legislation over controlling it and being able to manage it properly. With regards to usage, I think this is sort of in the infancy. I think more people are using it. I don't know if maybe raise your hands. Anybody use their patient portal? Do they have? Good. Okay. Oh, that's fantastic. So I think that's great. I think I'm a pediatric rheumatologist, so some of these slides are going to be a little bit more pediatric based, but I think for pediatrics it's a little bit harder. There's another layer in the sense that we do have protective privacy laws for adolescents, and so allowing certain things to be shown and not is another layer of complexity. So I think in a recent study done, a national survey showed about 12% of parents had set up portals for their kids. Again, I think probably because of the complexity, but I obviously think that this is growing. And I think in the Bay Area we're a little bit more tech savvy in general, and I think the health systems here are very robust in their patient portal, so I think that's great, and we just need to keep on spreading the word on that. And then also I think the providers need to learn more about the patient portals, because a lot of it is me telling my patient, oh, do you want to message me? We can do it this way. Or do you want to see what your labs look like? You can access it through your patient portal. And so a lot of it can be helped by the provider. And I think we as healthcare providers need to engage other providers to be able to not be scared of the patient portal too, because I think providers also have a little bit of a hesitancy as well for using it. So right now, I mean, the survey showed that only 1 in 5 patient families were getting offered patient portal use, and so that's obviously very low. So again, we want to try and get the word out. So there's some concerns. Interestingly enough, there was a study that showed that if you had a patient or you were a patient of a chronic illness, a chronic medical condition, you're more apt to use the portal, because I think, again, it helps establish continuity, right? Like it helps just, again, continue the conversation and with your provider, and it really does hopefully help with care overall over a long-term setting. But some concerns that came up, we talked about security, people worried about hacking into the system. There's errors, right, because they feel that, I'm not talking to you face to face, and maybe something got lost in translation or something like that. So worried about those kind of errors. They're concerned about the time to respond. Sometimes, which I think is very interesting, because I'm not quite sure if that's really the case, but I think the thought is that it's going to take longer for them to respond, through email or that kind of thing. My thinking is, some of this is really changing just the way you do care, and so a lot of times we have a telephone tag and it takes us 2 days to get back and forth to each other talking, but if I can, on my own time, like I have 15 minutes in between, I can go and look and shoot off that message, it might be actually faster. And so I think it's a little bit of learning how to use the systems, but then also not being scared of them. And then they're also concerned about who's responding. Is it really my doctor, or is it a staff member, and that kind of thing. And so I think there are again, it's a little bit of communication and trust, because I think once they see that it works, the interactions happen, and it's timely, and I think they'll get more use. But I think these are the initial sort of concerns. And I had mentioned that, again, chronic disease management people are a little bit more interested in. They felt that benefits included removing barriers to communication, providing control and independence, providing assurance, reducing anxiety, reducing wait times. I think in some ways there's a little more touch points because of that, and so I think that's actually very helpful. And again, concerns the other way people had talked about was maybe actually having too much access to data and not being overwhelmed by it. I think that it was a little bit scary for them. And then the loss of interpersonal contact, right? Like, I think they were also worried about that too. So these are also things to think about. But I mean, I do think with something like the loss of data, the access to lots of data, you know, I think in this day and age, I really feel more data is better, and then just managing it. You know, making sure you ask the questions if you have questions. There is a lot of data out there, and so we do have to be mindful of it, but I think it's your data. You own your own medical data, so you have the right to it. So, okay, so then I'm just going to go through just a little bit of the application so you know all the things that are available, because I think this is important, so you could use. So first, you can, where I'm actually just taking examples, and there are multiple different electronic medical records systems and different patient portals, but they all kind of have the same applications. And these are just screenshots from our patient portal, which we use our vendors called Epic. Stanford uses Stanford Children's and Stanford, and actually majority of the Bay Area health systems do use Epic, so you might see similar things from your health system as well. So you're able to register and put all your data information. You can schedule an appointment. There is billing opportunity where you can bill online. There's bill pay. There's you can do where like you can automatic bill pay where you can put certain money in at a certain time, that kind of thing. It's actually they're trying to catch up to I think the consumer websites where the Amazons and the all the other places that have really slick kind of business platforms. So I think we're trying to catch up to that too. Release of information. So it used to be really difficult to get your medical records, like your whole medical records, because the patient portal doesn't necessarily give you the entirety of your medical record. It gives you sort of bits and pieces. So if you want a full release of information, you'd have to go through the HIMSS, the Medical Records Office, which is like in the basement of some building that you'll never ever find. So now you can do that online. I think that's really easy, and they're able to check your identity and that kind of thing securely. So that's an option. Next one. Clinical reminders, I think, are really important, and I think you probably get these if you are already on portal. Reminds you to when your flu shots are available, when you have your next mammogram, and all these kind of health maintenance applications I think are really good to help you continue to be healthy, basically. And so that's an important application that you could use. Clinical results. So this is really important. I think the health systems are really understanding that, again, your data is yours and you should have it. And so there are lots of times you can get your labs, you can get your radiology results. There is some health systems that release it immediately, and some maybe have like a 24-hour sort of turnaround time to make sure, whatever, if there's a physician wants to look at it or if there's some abnormality, they can address it before you actually see it and go, kind of thing on it. So the clinical results, I think it's important. Sensitive results, just go back one more. Sensitive results, I just want to highlight, there are certain tests that don't ever get released, and I think those are more like genetic tests that you really need to have a medical provider talk you through the results. And so there are certain subset of tests that don't ever get released, and so if maybe you're waiting and you're not finding them, you might want to just reach out back to your healthcare provider and find out if that's the reason why they're not being released. Now there is a new initiative called Open Notes that is a national initiative, and basically it's really letting you have access to all your notes, which is great. I think it's not happening super fast. It's a slow sort of pilot program, but really it's important, and you could access it basically through your patient portal. But the concept, I think, is very new, obviously, because notes, and I don't know if you've ever read any of your notes, sometimes it can be pretty meta, it's a medical note. And so trying to get physicians on board to be like, okay, everything I write is going to go to the patient and the patient's family and that kind of thing. Everyone is sort of at a different level right now of like accepting that, and so there is an initiative, and so there are some places here in the Bay Area that we are doing that, so you can have immediate access to your notes, which is great. There is also this Open Notes initiative. If you go online, the www.opennotes.org, which is great, is that they actually give patients some information as well, because medical notes are obviously, it's not like a letter to family. There's actually like medical terminology and like the way they say things cut out and phrase things are sometimes unusual and seem kind of abrupt. And so those kind of things, the Open Notes organization sort of have given a couple of tip sheets for patients to be like, okay, this is how a note looks like and this is what you would expect. And when they say, all these negatives, it doesn't mean that it's negative. It's just this is the way they actually document. And so it gives you a little bit of a primer on how to read a medical note, which I think is actually really important, so you know the context of it, and that the doctor's not trying to be mean to you when they're like saying that all these negatives or whatever. And so I think this is actually a great initiative. So if you want to look at the Open Notes organization, you can see if your doctor does participate. There are some groups in the Bay Area that do, and then you can have access to your notes. Okay, language. The patient portals have multiple languages now. Spanish definitely, but they also have some of the other languages too. So just so you know, I think it's a great aid. Sometimes it's the Spanish one you can actually toggle between English and Spanish, which is nice too. So that's just an opportunity. Messaging, and I think this is one of the biggest positives of patient portals, just another way to message your provider. And so messaging is secure. You can message your different providers. As a pediatric rheumatologist, I can have the patient, the adolescent or whoever is my patient, can also message me separately, securely. So I think just again a nice, easy way to message. This is just a table of the recent message types that we had for our portal, and so obviously, again, the patient advice message is the biggest use case, and so we definitely use that the most. And I think with regards to messaging, I think that the big thing is that this is obviously not timely. It's a little bit time sensitive. People are not going to be reading it right away. So if there is an emergency or there is something urgent, a patient message may not be the best route to use. If you have a question about a medicine that's not urgent, you could wait. I think our routine suggestion is like 2 business days for turnaround time. So if you're okay with waiting 2 business days, I think a message would be the appropriate. But if you're not, then you might need to go, telephone or some other mode to get to your provider. Okay. Oh yeah. That's just again saying that we're increasing our messaging.
So, but I had a question.
Yeah.
That data, the chart, was it data from a certain messaging portal?
Yeah, so that's ours. That's Stanford Children's. I was just giving it as an example. But I think it doesn't have to be Stanford Children's. It could be Stanford. It could be any other sites, Kaiser here. That it's very significant, the usage. So basically, is what I'm trying to relay. Okay, and then there's questionnaires that can happen through the portal, and this is actually really a really good way to get information to your provider. There are pre-visit questionnaires that sometimes go to you, and then you can fill them out, and they'll go to your provider. And some of these questionnaires are great because the questionnaire goes to the provider, and the provider says, "Okay, I acknowledge the questionnaire," and then it will go, and then they can push a button, and it goes directly to your medical record, which is fantastic. So then they don't have to ask those questions again when they see you in person, right? So I think again, trying to not double do things is I think very important, and it's more efficient and more time. And even for registration, if you register online, then you don't have to go through the whole registration process in person in the front desk. So those are the kind of things I think that make things more efficient. For this, so there's just keep on going. In addition to the pre-visit questionnaires, there's data that we can get also, and I'll talk a little bit more about this, but blood pressure data, you can put in a little flow sheet. I know a lot of people have Excel spreadsheets that they keep track of their personal data and that kind of thing for weights or fever, diarrhea, blood pressure, or pain scores. Now again, you can actually have interactive, and then you put it in. It goes through to your patient portal, and you enter the information. It could actually go all the way through to your medical record that your provider could see, your nurse could see, and everybody who's taking care of you can see, which is really nice. And again, you don't have to reinvent the wheel every time, and you don't have to say it 5 times as well. There's post-visit questionnaires, that ask about discharge, post-op symptoms, that kind of thing. There is a big push recently on patient-reported outcomes, and that's like a different type of questionnaire, but it's still data from you guys, right? How am I feeling today? What is my pain score today? How functional I am today? That's all very important for measuring long-term disease activity and long-term outcomes on people who have chronic disease. So more and more we want to get information like that, which I don't think we've ever been able to capture very well. And so this is a modality that we could use. Disease activity, was I able to get to my medicines? Did I take my medicines today? Medication adherence, those kind of things. Screening, that's the other thing. Screening for depression, screening for some other mental health issues, I think also can go through questionnaires. So again, all of these things are available potentially through your patient portal. Okay. These are just, again, screenshots. This is a questionnaire for GI. I didn't have one for rheumatology, but you have your date, you talk about, just in general questions. You can go to the next slide. And they can even have like these buttons that will fill in. And again, all of these could then fill into your medical record, so nobody has to double enter. Next is a flow sheet for blood pressure. Like you can add your blood pressure issues. I mean, I think ideally this is the first step. The next step would be obviously like a Bluetooth-enabled blood pressure monitor that you have at home that then would upload to maybe your phone or your iPhone or your Android, and then it gets directly connected over to your medical record, which is happening, which is also really great. And I'll talk about that a little bit later. This is just another way you can actually graph. So after you enter the data, you can graph it, which is really nice. And then that opportunity is available in your patient portal sometimes, and you can see what your blood pressures are looking like, your weight is looking like for your own self. Okay. All right, so that was the patient portal. I wanted to talk a little bit about because I think it's really important, and there's a lot of functionality there now. I wanted to sort of broaden it a little bit on telehealth because I wanted to talk a little about the different modalities in telehealth that are available that you may not know. This is just a general definition of telehealth from the American Telemedicine Association, and I'm just going to read it because it's a quote. Use of medical information exchange from one site to another via electronic communication to improve a patient's clinical health status. Includes a growing variety of applications and services using two-way video, email, smartphones, wireless tools, and other forms of telecommunication. And is not a separate medical specialty. So it is on top of whatever specialty, like rheumatology or GI. And we use it as a form, an additional form of communication and care platform. Okay, so next. So I'm just going to go through a little bit and talk. There are two different, we kind of break them down, asynchronous and synchronous, different types of digital health innovations. So asynchronous, I've already talked a little about, like questionnaires. So they give you a questionnaire, you fill it out, and it goes back. So that's sort of like not real time. E-visits are another form that is not real time, but that people are doing now. So it's basically you message them with like a question and becomes something a little bit more, and it turns into an electronic visit, and then and instead of actually going in to see them, you can actually handle things by messaging or email. Another asynchronous is like patient-generated data, like your blood pressure, that kind of thing. Glucose, if you're diabetic, your glucose sticks, and you're data managing there. Synchronous is now definitely up and coming, and these are the more like phone visits is obviously the very, very basic ones that we like patients or providers already do, but that is a form of telehealth in some sorts. But video visits is the next big one that I think we've been starting to push out a little bit more because, you know, it's really hard sometimes. We have patients that come from 5 hours away, and it's a real hardship to take a whole day off of work or school to get to a 20-minute visit and go all the way back, a 5-hour drive. And so I think video visits, when it's appropriate, is actually very, very useful. I use them for just follow-up visits, for post-op visits, for teaching. Like if we need to teach how to do an injection, our nurse can actually be there. The patients have all the stuff at home, and then they just talk over the. I mean, it's basically like FaceTime, but it's a little bit more structured and within the electronic medical record system, which is great. Yeah.
It's kind of relevant, but I'm just curious. How would the payers, the insurance, view a video visit? Would they bill in the same way?
That's a great question. Yeah. So for payers. We are lucky in the state of California is that they pay on par, which basically means they pay exactly like an inpatient visit. Because they recognize that obviously there are things you can't do, right? You can't touch the patient, but you can have a very meaningful visit and, by other means, and I'll talk a little bit more other ways. You can listen to their heartbeat and look in their mouth. There are tools that can enable that, and so definitely for right now we're getting reimbursed the same. So it's been great, and actually the state of California has been really very supportive of this. So I think overall video visits are going to hopefully continue to increase. Then there's also interesting talk about sort of visits in areas or sites that you don't necessarily think about. So they're now like clinics in your work offices, right? Like Cisco has a clinic now, right in their clinic, in their office. They have daycares in their office. So then would we just have like a pediatrician on call? So if somebody in the daycare needs it, they can do a video visit right there. So again, trying to make things more efficient and cut down on time. So those are opportunities as well. Okay. This is just. I think I talked about all of these pretty much, but they're on the right-hand side. There's a physician doing a video visit. Then on the bottom, there's actually some technology, some tools that you can actually see. Look how the eye, and then the provider can look at the eye pretty nicely. I mean, there's a lot of great technology that we can utilize currently. Okay. Some more talk about patient-generated data. We call it PGD, or patient-generated data. I think you guys are very familiar with the wearables like Fitbit, the pedometers, Apple Watch. Those are all getting data about you. And why can't your providers know about that data? And so we talk about looking at how we connect those sensors, so you can have Bluetooth-enabled scales, blood pressure monitors, pulse oximeters to measure your oxygenation, spirometry, how you're breathing, like for asthma, that can be connected. Medication trackers, those are kind of interesting. They're like how many times you open your bottle. So it's actually a sensor on your top of your bottle of medicine. And then they can kind of track, if you didn't open it today, obviously you get your medicine. So those are interesting trackers. Bed chair sensors, whether or not you're sitting up in bed, if you're getting up, if you're moving. Because I think activity is obviously very important for your health, general health. So those are options. Here is just a couple more pictures. I talked a little bit about video visits. There's more detailed video visits like telestroke, telepsychiatry. That's actually very strong. Teleradiology. There's another form called Stored Forward where you have you take pictures and then they go to a physician to look at and figure out what's going on before it comes back. And then I already talked about the remote patient monitoring. Next slide. And then this is just, again, more pictures, because I think I like pictures. Going from sort of simple with the telephone and the iPhone kind of.
What's that thing on the left, the one with the handle?
This one?
The black thing on the top.
So this is basic, simple, telephone. And then they have low complexity, which we talked about a little bit. And then higher, which I just wanted to highlight because I think it's actually really cool. On the top right, I know it's a little small, but you can kind of see like it's almost like a robot. So they have these these physicians that aren't maybe in the hospital, but they need to go see somebody in the hospital, they can actually drive the robot. It's a little crazy, I know, but and then get to the, and then round with the team as a robot, with your face. So it's an interesting sort of technology they're looking at. And also down here, there's some remote tools, so you can if you have like a support staff on the other end with the patient, they could put something on their eye, you can look at their eye, put something in their ear, they can look in their ear very clearly, in the mouth, skin, you can have a really detailed look at skin. So I think, again, very, very detailed and very easy to assess. And then down here on the bottom, we're actually doing a study. This is the Oculus, which is the virtual reality goggles. We're currently doing a study at Stanford Children's where they're actually using these virtual reality glasses in kids for anesthesia and for pain, and it's been working amazingly. The kids just get immersed in this, and then they're done. You can do whatever you want to them. They get an IV, they can get a shot, and they're just fine. They're trying to catch the dragon or whatever. So it's actually been very, very useful. But I think it, also for simulations, I think it's also useful for that. But that obviously is a little bit more high complexity. I wanted to highlight the in the middle, the low complexity stethoscope. You can have an augmented stethoscope where you actually, somebody's putting a monitor on the patient, and you can hear what the stethoscope is from the other end. So you can really do a very good physical exam. The only thing I think, with regards to rheumatology, I am a rheumatologist. We cannot assess joints very well remotely. So, and then that's fine. I mean, there is limitations, and you accept the limitations. And I say, I had a patient, and I was like, oh, let's do a video visit. And they're like, oh, my wrist hurts. And I'm like, no, then I can't do it. You need to come in to see me. And that's the way it is, and that's okay, right? I think you just determine what works depending on the situation. Okay. I think this is, I'm sorry, I'm going overboard on the pictures. Okay, actually go back one.
Okay.
These are the ones that would you put in the ear. Sometimes they attach to the phone and you can take a picture. So again, these are all available. So again, and they're not crazy expensive. And this one is, I think, really interesting. It's a portable ultrasound. You can maybe even do on the joint and look at some,
Somebody, just a quick comment, I kid you not, somebody showed me you can actually buy a pill camera for $99 on Amazon.com. You swallow it and it sends a signal to your iPhone. Basically, you're doing your own colonoscopy.
Oh, God.
$99.
Okay.
Not going to ask how
I didn't put that up there. Okay. And I'm sorry, this is a very busy slide, but again, this is just showing you all the different sensors, how they connect through Wi-Fi, through Bluetooth, and then how they get to your computer, and then they've got to download over into your electronic medical record or things that you can then interpret the data with. So that's sort of the flow of it. But it's exciting. This is a slide I just put together of some recent research looking at patient-generated health data, and actually it does have positive outcomes. So we had Pediatric Diabetes, where they're able to access, patients are able to access blood glucose and be able to trend data, and you can actually real-time, look, oh, I'm actually not doing well, or I'm doing really well. That's very helpful because that's feedback, right? Chronic congestive health heart failure patients, they got a blood pressure cuff and a scale linked to an iPad. That actually saved in-hospital readmissions. And so there was actually direct outcome using some of these technology. Same with asthma patients. They had Bluetooth-enabled inhaled sensors that were able to feed back and give information to the providers and to themselves, and they had a decrease in need for rescue inhaler use. And hypertension, same thing. They're able to look at the blood pressures meaningfully, and because they were able to get that feedback, we're able to decrease their blood pressure. So I think overall, these are all good things. We obviously have a long way to go to get everything like this, but I think it's a start. Next, please. This is, again, a very big busy slide, and I'm not going to go cover it. But basically, at Stanford Children's, we actually developed a way to. This is a diabetes platform. This little kid has a continuous glucose monitor, so they actually have it on their skin, and they basically measure blood glucose every 5 minutes, and then it connects through all these different things, through their phone, and it goes directly through to their electronic medical record. So then the provider can go in the next slide. Show the next slide. This is what it looks like on the phone, and then this data just directly dumps over into the electronic health record. And then the next slide will show what it looks like in the health record. I know it's kind of messy, but it really shows trends. Like you can see if they're high or they're low. And this is actually really important because good glucose management in diabetes is very key to health, to good diabetes prevention. So we can tell if they're low, we can tell if they're high, we can tell who's doing what. On Mondays they're doing this. Why is that happening? Oh, it's because they have a pizza party with their friends every Monday or whatever. Those kind of things I think is very useful. Okay. And then I just wanted to talk just quickly about inpatient monitoring because I think this is also new, a new feature. Basically, it's being able to access when you're in the hospital your data, which I think is not. Hadn't happened in a long time, right? Doctors round, they see you, and they round, they tell you what's going on, and then they leave. But here you can have direct access to your data real time, which I think again is more information for you, and it's good. It felt, many people were very satisfied. They felt it helped reduce errors. You can message your providers whenever you needed to. And then just more information to you, like who are your providers, who's coming to see you. All that stuff is also part of it. You can get your vitals, like what your blood pressure is doing. So I think overall that was very positive, and and this is just a screenshot of that sort of thing that you would see. Why are you here? Your vitals on the bottom. Who's taking care of me? Your medications. All this stuff actually, especially when you're not feeling great in the hospital, is a little overwhelming, right? And hopefully this helps organize it for you a little bit. And then the last thing I wanted to talk about, which I think is really interesting, and just again similar to the sort of pill swallowing and get your little picture of your insides. Is that there is a hospital in children's in Dallas, in Texas. They actually partnered with a company here in the Bay Area. The company basically has built a little, with some manipulation, a little sensor that they embed into the medication. So then you can actually tell if they've taken the medication. And then you can monitor adherence, especially for transplant, right? The ones that are very risky if you stop taking medicine. In lupus as well, right? I think it's very important for continued medication adherence. And so I think this is sort of potentially the new wave of digital health. I think it's interesting, maybe a little scary, but I think we'll see more and more of these, and I think it's just something to think about and very interesting to see which direction it's going to go. I think that's my last slide. So was there any? So hopefully I got you some information about sort of the different modalities and platforms. And if you have any questions, just please let me know.
No question? Okay. I kind of had a question, which is, what happens when somebody switches healthcare system? Do they have to set this all over like that?
So it's a great question. There are a couple of things. So the electronic healthcare record vendors, there are multiple vendors, but there is a vendor in the Bay Area that has quite a few of the health systems. So if you are in a health system that has the same vendor as another health system, you can share data. So I can see at Stanford Children's, I can see medical records from Sutter and from Kaiser because we are on the same vendor, not because we have the same patients, we are the same vendor. and they're enabling the data exchange so you can see. So that's one way. There's also another way. It's a health information exchange, HIE, which is separate from the vendors, that you can actually exchange information about a patient, a shared patient as well. So those are the two different ways. That's a good question.
Any other questions? Okay. If not, thank you so much.
Oh,
I'm sorry. So it took me a minute to digest that. So if the patient is coming to see a physician for the first time,
Mm-hmm.
and they have all of this records in a different vendor,
Mm-hmm. Mm-hmm.
getting access
In a different
to
health system.
a different health system, different vendor, different whatever. Access used to be required with a signature, so you
Correct.
couldn't get the data before the patient came. Has
Right.
that changed?
So no, you still have to access. You have to request access by the patient first, still. So you still have to do that,
Can
but
they,
electronically.
they can do that before their visit to
Yes.
send it?
Yes,
Okay.
yes, electronically now. So it's a little easier. Yeah. Anything else?
Okay. All right. Thank you, Solange.